In today's topic, we will be discussing a very interesting and an important topic, GCS, Glasgow Coma scale. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon so that you receive instant notifications. Let's get into the session. What is GCS? Glasgow Coma scale is the most common scoring system used to describe the level of consciousness in a person following a traumatic brain injury. Next, what do we do in GCS? First is check. Here, we check for factors interfering with communication, ability to respond, and other injuries. For example, in case of tracheostomy, endotracheal intubation, and dysphagia, etc. Next is observing. What do we observe? We observe for eye opening, content of speech, and movements of right and left sides. Next is stimulate. Talking about stimulation, there are two types, central and peripheral stimulation. Central stimulation examples include periorbital pressure, trapezius squeeze, and jaw margin pressure. Examples of peripheral stimulation includes nail bud or fingertip pressure. Next is rating. Here we assign scores according to the highest response observed. GCS score is used to grade and plan treatment of patients with head injury. It can also be used to monitor neurological status of critically ill patients. Now, let's discuss about the components of Glasgow Coma scale. There are three components: eye opening, verbal response, and motor response. For eye opening, a maximum possible score of 4 is given. For verbal response, a maximum possible score of 5 is given. And for motor response, a maximum possible score of 6 is given. The score is determined by the sum of the score in each of the three categories, with a maximum score of 15 and a minimum score of 3. Now, let's discuss about eye response or eye opening and how the scoring is done. First is E4, that is spontaneous eye opening. Here, the patient will be opening his or her eyes without any external stimulus, and this indicates that arousal mechanisms in the brainstem are intact. Next is E3, eye opening to speech. Here, this is tested by verbal approach, either spoken or shouted verbal approach. Next will be E2, that is eye opening to pain or stimulation. This is tested by a physical stimulation in the limbs. Here, supraorbital pressure should be avoided because it may cause grimacing and eye closure. The last will be E1, that is none. Here, there is no response to verbal and physical stimulation. Sometimes the scoring is mentioned as NT, that is not testable, which may be in case of edema, facial trauma, or dressings. And sometimes it is denoted by C, that is eyes closed due to swelling. These letters may differ according to the institutional policies as they are designed. Let's discuss about the next component, that is verbal response, where we try to engage the patient in conversation and assess if they are oriented. The first score is V5, that is oriented. Here, patient is aware of self and the environment, who, where, and when. Patient must be able to identify who they are, where they are, and the month or year. The next scoring is V4, that is confused. Patient responds to questions with presence of disorientation and confusion. A patient is classified as confused when one or more of the questions are answered incorrectly. The next scoring is V3, that is inappropriate words. Here there is no conversational exchange. Patient tends to use single words more than sentences. The next scoring is V2, that is incomprehensible sounds. Patient may be mumbling, groaning, or screaming. And the last score is V1, that is none. Here there is no verbal response at all. Other scores like NT, that is not testable, is given if the patient is intubated and it is mentioned as VET in case of endotracheal intubation or VT in case of tracheostomy. If the patient is unable to speak, that is dysphasic, it will be marked as D. Now, let's discuss about the last component, motor response. The first score is M6, that is obeying commands. Here, the patient obeys commands. Patient does simple things as asked. Example, lift your right arm off the bed, show the tongue, open or close eyes, make a fist. The next score is M5, that is localizing pain. Here, movement of limb as to attempt to remove the stimulus, the arm crosses midline. The next scoring is M4, that is normal flexion, rapid withdrawal and abduction of hand or shoulder. The next scoring is M3, that is abnormal flexion, flexion in response to pain. Decorticate response, that is arms flexed or bent inward on the chest, the hands are clenched into fists and the legs extended. Next score is M2, that is extension to pain. Here, extension to pain is recorded when there is no abnormal flexion to painful stimulus. Decerebrate response, that is rigid adduction and extension of the arms, legs stiffly extended, downward pointing of the toes, backward arching of the head, wrists pronated, and fingers flexed. The last score is M1, that is none. Here there is no motor response. No motor response is recorded when there is no response to a painful stimulus. Let's discuss some of the factors affecting the Glasgow Coma scale assessment. Language or cultural differences, intellectual or neurological deficit, hearing loss or speech impediment, physical, for example intubation or tracheostomy, pharmacological, for example sedation or paralysis, orbital or cranial fracture, dysphagia or hemiplegia, spinal cord damage, and communication barriers. Here you go with Glasgow Coma scale assessment and scoring.